Hello and welcome to For Your Health. I'm Mark Crosby of Quincy Access Television. Thank you so much for joining me and actually joining us. I'm here with Caitlin Kirby, who is a public health nurse in the city of Quincy. Caitlin, welcome back.
Thank you for having me.
Always a pleasure. Today's topic is one that we have covered every year since you came on board to the health department, and that is the influenza.
Yes, as we know, flu season every year. You just want to make sure you're prepared for it and you're getting your vaccinations. And every year there are updates as far as what the vaccination will cover. So it's very important to make sure that we update it each year.
Very good. So we will be looking at the 2024 into 2025 flu season, and we will start with an outline. We will ask, what is the flu? We will look at common symptoms, how the flu spreads, what's new this flu season, prevention, and we will end with resources. So even though it's pretty obvious, or it might seem pretty obvious, let's start with the definition. So what is the flu?
Yeah, so the flu is a contagious respiratory illness that is spread person to person, and it's caused by the influenza viruses. And it infects the nose, throat, and sometimes even the lungs. So depending on the person, they may have very mild symptoms of the flu, but it can be severe, and in some individuals it can lead to death. So it's very important that you're doing all preventative measures. And it's just important to note where some people do get severe illness. We are looking specifically at people who are high risk. So that would be individuals 65 years and older, young children, and people with certain health conditions. So it's very important to work with your provider to kind of know your risks. And then it's the type A and type B strains that are spread person to person that causes the flu epidemics each year.
And I guess I know the answer to this question, I'm pretty sure, but how does the U.S. know what strains are circulating in any given year?
Yeah, so there's a World Health Organization. So I believe I have it in my notes here. I thought I had as many. So I believe I don't have it actually written down, but in 144 different countries around the world, they're monitoring these strains. So these labs are testing well, not the labs specifically, but the doctors are testing and sending these specimens to these labs. And they're doing all the research and work to see what strains people are getting sick with. So this is being monitored all year long because the flu epidemics are different in different countries.
They have different start and end.
Yes.
Okay.
So that's how, in all of these laboratories across the world, they're monitoring what strains are going around, what people are getting sick with, and that's how we are able to look at what strains have to protect against for our vaccines and to update them.
Very good. As we look at the common symptoms, some of these symptoms are also symptoms of other illnesses, so people should be aware of that too. But common symptoms, people will be familiar with many of these as well.
Yes, especially as we're still on the wings of the COVID-19 pandemic, a lot of symptoms, and with any health condition, a lot of symptoms can mimic other illnesses. But you definitely want to make sure you're monitoring for fever, chills, sore throat, a runny nose or congestion. It could be either or. Muscle and body aches, headaches, fatigue. And then we also see nausea and vomiting and diarrhea, which is mostly we see in younger children. But again, these can mimic other respiratory illnesses. So make sure you're checking in with your doctor, you're getting tested. And if you're sick, stay home because you don't want to be spreading this to other individuals.
Good point. You are no hero if you go to work when you're sick.
Yes, because then you're just going to spread it to everyone around you, which is not great.
And that actually brings us to, no, that's not great at all. And that brings us to how the flu is spread.
Yeah, so it is, it's called droplet transmission. So it's spread person to person. So when a person is infected with the flu, when they cough, speak, sneeze, basically in their saliva, that does go a certain distance when they're talking. That saliva, if it lands on somebody else, and it gets into their mouth or eyes or nose, they can then get infected. And it's important to know that people that are infected with influenza, they can spread it a day before symptoms start, up to 5 days after. And then if individuals do have a weakened immune system, they can spread it for even longer.
Which is good to note. Well, not good to note, but it's good that you said that, I suppose, because when people sneeze or cough, again, and we'll probably get into this later, but do it into your arm, into your sleeve, so you're not spreading it out there.
Yes, because another way, less often, the flu virus can live on surfaces as well. So basically, if I'm just coughing onto a table and I leave, the next person who were to sit there, if they're touching it and then they're touching their face and mouth, they can get infected that way as well. So that's a very important thing, especially when we teach young children, proper hand washing. But definitely sneezing and coughing, you want to do it into an elbow. So that way at least the germs are contained to yourself rather than surfaces around.
I think it used to be that you could sneeze into your hands, but let's think of how often we use our hands to touch either someone else's hand or an inanimate object. And if we're doing that, we're spreading whatever is on our hands.
Because you want to think of those high touch surfaces, so tables, doorknobs. A big thing nowadays, cell phones. You don't think of you're traveling all day long. You want to make sure that you're washing your cell phone. Just to because there's a lot of germs on your hands. And then if I'm touching my phone all day and then I'm laying in bed on my phone, the germs are still there. So it gets you thinking.
Absolutely. And they can last on surfaces for up to 48 hours.
Yes. And there are a lot of cleaning products out there that do say they can kill these viruses.
They usually say 99.9%.
Yes. So just make sure any cleaning product you do get, just make sure you're following that label on how to use it.
Very good. All right. New. Just in. What's new about this flu season? Again, we are talking about 2024 into 2025.
Yeah, so new this year, so the composition of the vaccine has been updated. So in years past, it was quadrivalent, meaning that the vaccine protected us against 4 different strains of influenza A and B. But now it's actually kind of considered a public health win because one of the strains, the FDA in collaboration with WHO, which is that World Health Organization I mentioned, they declared that the B. Wymagata influenza virus, that strain is no longer circulating worldwide. So that's kind of a public health win because through vaccination, we were able to eliminate that strain. So the FDA has informed all manufacturing companies to remove that strain as soon as possible. Preferably by this season, the 2024-2025 season. But if you were to still get a quadrivalent vaccine, that's okay. But I do think the majority we will be seeing this upcoming season will just be trivalent. And I do have on our slide the exact strains that will be covered for the egg-based vaccine and then the cell-based vaccine. And you can see that there's an H1N1, an H3N2, and then the B Victoria lineage virus. So those will all be protected against this upcoming season.
And just go over, if you could, the difference between egg-based and cell or recombinant.
Yeah, so basically, because the egg-based, the reason that there's two different ones at this point, we do have a lot of individuals in the population who are allergic to eggs. So what they were able to do is the cell-based vaccines, those are created in a lab, not using eggs. So it is safe for an individual who has an egg allergy to get the vaccine.
Very good.
Yes.
All right, prevention, which is always a big part of our programs. If you can prevent getting sick in the first place, that's a win.
Yes, yes. So definitely the biggest way to protect yourself is getting your annual flu vaccine. A lot of times in public health, especially with all the COVID vaccines we've been seeing, we are tending to see a little bit of vaccine fatigue where people are sick of getting their vaccines. But it's very important to make sure you are still following up and getting your annual flu vaccine, especially if you're high risk or if you're around people that are high risk. A lot of times the way I think of it is I don't mind if I get sick, but I don't want to be spreading it to my loved ones, to my coworkers, because you never know who they're around. And if they're around somebody who's high risk, they could get severe illness and pass away. So it's very important.
I do want to just stop you for just a second.
Yeah.
Do you ever get, as a health nurse, do you ever get the statement from somebody that I didn't get the flu until I got the flu vaccine?
Yeah, so we have heard that. Typically the flu, you wouldn't get the flu from the vaccine itself. It could be after you got the vaccine, you got exposed somehow and your body couldn't build immunity against it. So it doesn't go hand in hand. It doesn't come from that actual flu vaccine. But we definitely do hear that a lot because there's so many theories out there and all of that, but there's so much research done behind our vaccines that are offered. And all of that information can be found on the CDC website or the state website. So here in Massachusetts, but that goes for any state. You can really investigate and just know your facts. If you're frightened to get the vaccine for any reason, check in with your doctor and just make sure it's right for you. Because there are certain conditions where you cannot get the flu vaccine. For example, if you had Guillain-Barré syndrome, which is a very rare reaction you can get from a flu vaccine. If you had that in the past, you cannot get the flu vaccine in the future. So make sure you're checking in with your doctor. But for the most part, it's very safe for the majority of the population to get.
And I will bring this up. If you're pregnant, like you are, the vaccine, do you get it?
Yes, you would still get it if you're pregnant. Again, you can check in with your healthcare provider. Especially with pregnancy, I check in with the doctor for everything, just to be safe, but you should still get your flu vaccine.
You had touched upon this, clean and disinfect surfaces.
Yeah, so this goes year round, but especially during flu season. And as we know, it's not just flu season, it's COVID as well as circulating. You want to make sure you're cleaning and disinfecting. Again, those high touch, commonly touched surfaces. So think of your tables, your doorknobs, your cell phone, as
Right.
I said.
If I was sick and I handed my phone off to you, you could get it that way.
Yeah, so it's really important to make sure you're cleaning those high touch surfaces. And even like think of that in your workplace. If we have somebody that walks into our office and they're reporting that they've been sick for a while and we refer them to go get tested for COVID or whatnot, we will always make sure that once they leave, we're wiping everything down. Just to be safe. You don't want it to spread to others.
And avoid close contact with others. This is always, I guess, a challenge around the holidays.
It is, and that's a lot of times where we see a spike in transmission. If you think back during 2020, we didn't see as many cases of flu because everybody had masks on, people were isolating because of COVID, but it helped limit our flu numbers as well. So you want to make sure you're keeping a distance, especially if you're sick or somebody around you is sick. And that leads into, if you are sick, stay home. And I like to think of it where you could be potentially infectious a day before symptoms even start. It's always very respectful to let those around you know. Of course, that gets into like HIPAA and your own personal information. But if I were to get diagnosed with the flu, I would tell my coworkers, like, this is when my symptoms started. I could have been infectious this day, just so they're aware and they're monitoring to make sure they don't become sick themselves.
We also talked about covering your nose and mouth when coughing or sneezing. Again, cough or sneeze into your sleeve.
Yes, just to try to limit the spread. Because again, that virus does live in the saliva. And that goes right into washing your hands as well.
But wash your hands correctly, because there is a correct and incorrect way to do it. I suppose there's a quick way to do it. There's a longer way to do it, which we should all do. And then there's that whole length of time is important. Not only the coverage area of your hands, but the time that you're spending washing your hands.
Yeah, so the best way, soap and warm water. Warm water and soap. You want to do like 2 happy birthdays in your head. Make sure you're getting the top of your hands.
Sing out loud if you'd like to, right?
Yes, you can sing out loud as well.
You might look a little strange.
Yeah,
That's okay.
you want to make sure you're getting under your fingernails and everything as well. We have in the health department, we do sometimes with like young children, we have you put powder on their hands and you have them wash their hands, and then you do a black light over it and they can see the germs left behind.
Cool.
But it's a very good way to kind of teach, like, if you are doing that real quick, you're really not washing the germs away. You really want to make sure you're cleaning for the right duration of time. And just with that, if you are on the go, having hand sanitizer in your car is always, as a public health nurse, we always do that because we do home visits and such. But the best way, that's good on the go, but when you do get home or to your workplace or wherever you're going, wash your hands with soap and water.
And getting back to the hand sanitizer, what that does, I understand, is it creates a surface that germs really can't stick to well, correct?
Yes. So it's definitely, it's good when you're on the run or on the go. But again, just always the best way is washing your hands. So I always say when you get to your destination, make sure you wash your hands right away.
And we mentioned this, or you mentioned this as well. Avoid touching your eyes, nose, and mouth because those are inlets.
Yeah, so like your mucous membranes is what they're considered. So your body would be able to absorb the virus. So definitely, we learned that a lot during the pandemic, just how dirty your hands can be. So you want to make sure you're never touching your eyes, nose, or mouth without washing your hands.
And I forget what study was done, but it was a study based on how many times a person touches their face in the course of a day. It's a lot.
It is a lot. I feel like a lot of us, you don't realize that because it's just a habit.
Right.
I think going through the pandemic for a lot of us made us truly realize what's at stake, basically.
One thing I don't see on this list, and maybe it's a new thing because of COVID-19, is the wearing of masks.
Yeah, so definitely if like you're going to like a healthcare appointment to get tested for flu, put a mask on, and they'll advise you right at the door to put, like I feel like hospitals always have had the masks, obviously, but now after the pandemic, we're way more likely to have you put one on and have it right at the door. So definitely if you are sick with flu and you have a mask and you have to run to a pharmacy, put a mask on just to protect those around you.
And I suppose if you're someone that is compromised, if your immune system is compromised, by all means, wear a mask
Yeah.
during the season if you can.
Yeah, and that's a good way because a lot of times, like, there's many events, especially in the fall. Like, we have our holidays and all of that. So, if you're going to a group setting and you don't feel comfortable, or maybe you're immune suppressed, put a mask on to protect yourself. It doesn't hurt to put at least a barrier to help lower your risk of transmission.
Right, because that's an added level of protection.
Yes.
And practice good health habits, such as hydration, healthy diet, and adequate sleep. Sleep is important.
Yeah, so sleep, so hydration, healthy diet, and adequate sleep, very important for your overall well-being. And so your body needs all of that in order to fight off viruses and maintain the healthiest version of yourself. So definitely make sure, and I know a lot of people unfortunately do struggle with sleeping and so forth. Check in with your doctor to see what's right for you and if there's any remedies to help you sleep, such as like magnesium or so forth. But you want to make sure you're that even goes for exercise as well. You want to make sure that you're having your body at like optimal function, basically.
And as far as hydration, a lot of us don't drink what we should be drinking in a given day, correct?
Yes, a lot of times we've been way under. So there's a calculation. I don't know it off the top of my head, but like specifically, especially when you are pregnant, you're supposed to ramp up your hydration too. I feel like it's a little bit easier nowadays. I feel like water bottles are a big thing now, where people always have a water bottle on them. But I always say, like, try to have a couple, cups a day, at least 8 glasses a day.
And I think, well, go ahead.
I just want to stay hydrated because it really does lead to like headaches and all of that. Like you're not going to feel great if you're dehydrated.
Right, and simply carry the water bottle around, I suppose, and just kind of sip. You don't have to gulp or drink a lot each time. Just, I guess you can even it out throughout the day.
Yes, yeah. And a lot of times they even, I believe down in our department actually, the water bottles that we give out on different events, it actually has like measurements on it with a time. So it's like by 1 o'clock, drink this much and so
smart.
forth.
I like that.
So there's a lot of different tips and tricks out there to help increase your fluid intake throughout the day.
Very good. I guess one of the last questions before we get to the resources, I guess the question is, when does the flu season start? When does it end? And when should folks get the vaccine? If they get it at the beginning, or if they get it too soon, I suppose it's not going to last throughout the whole flu season.
Yeah. So typically they advise like starting around August, you can potentially start getting it. And then the flu season, it goes all the way through March. So you want to make sure, like, if you're unsure of exactly when to get it, check in with your doctor. They may advise you to hold out a little bit longer than August. But I do know as a health department, that's when we start getting our calls and start scheduling. We do like homebound vaccines for individuals who are homebound and cannot leave their house for doctor's appointments. So around August is when you start to see the vaccinations. and it goes all the way through the end, through March and April.
So for homebound folks, they would just need to get in touch with your office?
Yeah, so for Quincy, if you're a Quincy resident and you are homebound, or a loved one is homebound and they need their flu vaccine, you would just call the Quincy Health Department, and myself or my two coworkers, Deb and Karen, we would schedule an appointment to come right out to your home.
And if you live beyond the city limits, because this program does circulate, it's actually got a wide berth.
Yeah.
But folks should get in touch with their local health department.
Yes, I always say reach out to your local Board of Health just to see what resources could be in your area.
As we end on resources, you mentioned the Center for Disease Control. That's a great resource.
Yeah, so the CDC, so that's where all this information has come from today. You can also look at that World Health Organization website as well. It's both websites plentiful on all like their research on this upcoming season. At this moment of recording, as far as the flu supply, it's still unknown at this time because those FDA for like the trivalent, that information just came out. So we'll be finding out from our manufacturers shortly to see how big the supply will be this year.
And I guess lastly, because you are pregnant, I do need to ask, what is the age that individuals can get the shot? Obviously, infants don't get the shot.
No, so typically, I'm not sure. I don't know the exact age. I think it would be after a year.
Check in with your pediatrician.
The pediatrician would be the best one to check in with. And that also goes to show like your check in with them before any vaccination, of course. With infants too, all of their vaccines are through their pediatrician. You wouldn't really go to like a CVS or a Walgreens. That's more for adults. But check in with your doctor to see the right time for your child to get vaccinated.
Very good, very good. Great show once again. Thank you so much for joining me today.
Absolutely. Thank you for having me.
You're very welcome. And thank you at home for watching. And just please remember to support the local access station in the community in which you live. Take care. Stay healthy.